Hey teams, Lauren and Rebecca here with Bizrok. In this week's training video, we're going to talk to you specifically on some important clinical best practices, specifically when it comes to medication. Rebecca, I'm sure that we could probably sit here for hours and swap horror stories from practices where we've gone in and, we're like, hey, what's your medication process? And we're always floored by some of the things that happen. So today's video is perfect timing.
It is.
But also important to talk about the process and protocol. So can you touch on that for us?
Absolutely. So every state is different on protocols when it comes to in-office medication. But I would always start with making sure that you provide bottles for all your medication to go in and not to hand medication in envelopes, the little manila envelopes to patients for a couple of reasons. First off, you would like to make sure a child can't get into them once you get them to the house.
So the child-proof sacks.
Child-proof,
okay,
yes.
Perfect.
Child-proof tops is what I would recommend. And then on the bottle to place a label. Place the patient's name and date of birth and what medications are inside the bottle. You want to protect yourself, the doctor, and the patient. So when they're on their drive home, we do not know where all they are going or any stops are going to be made. So just in case someone were to break into their vehicle or they were getting into an accident on the way home, you want them to be protected. If a police officer finds a container or an envelope of medication that's not marked, the patient could get in trouble and or we will be liable at the office.
I'm glad that you're bringing that up because we hear these stories all the time, actually on our side because we're in so many offices, but it's something that's innocently done in the practice. I mean, there's no ill will or ill intent.
Absolutely.
It's just something they don't think about, right?
They do not. And it's the same as having, I always say, have one lead. You're going to have one person that's responsible for the medication and disbursement within your office and keeping track. That's going to be inventory, who is given what at what time and what date. Have a backup person. Everybody gets sick. Everybody has the right to take some days to themselves, which is fine, but have that one backup person that's trained as well, but have a sole leader in just the medication disbursement.
Correct me if I'm wrong, but I think we even have like a medication tracker for the practice to use. So guys, that's just a basic Excel sheet. But if you need help, reach out to us. We'd be happy to share that template with you. But if it's not tracked, it's not actually happening correctly, right? And then there's nobody to go to. There's nobody to hold the team accountable for what's happening in the practice.
And lastly, please put notes in the patient's chart.
Yes.
The date and time and what medications were picked up and who picked the medications up. So if it is a minor, a parent, or anyone that's on the release form can pick up medication, but no one else. And then also the patient themselves, if they're over at the age of 18, they need to pick up their medication so that way we can go over everything with them and it's not third-party information.
Love that. Awesome. Well, guys, thank you so much for your time today. If you need help or you need guidance, reach out to us. Send us an email, info@bizrok.com. That's BIZROK. But Rebecca, thank you so much for walking us through that best practice. And as always, guys, we can't wait to see you and serve you soon.